when I was in medical school, when you're in your third year, you start to get your diagnostic instruments and things like that you use to examine the body. Well, so when I got my ophthalmoscope, I was very excited. Yeah. And I was at a hospital that had 16-bed wards. So it was a huge, very big hospital. And, there weren't really any private rooms. They were just big wards. So it seemed like after, a month or two into our third year of school, medical school, that I was the only one going from bed to bed through that 16-bed ward looking in everybody's eye. So I said, well, I guess I'm going to be the eye doctor. Because to me, to be able to look in the eye and see a local disease, see a systemic disease, see diabetes or high blood pressure or brain tumor or just about anything was unbelievably fascinating. And then when I knew I was interested in it, I did a rotation at the eye hospital there. And I'll never forget the first time I looked through the slit lamp microscope, which is the instrument we use to look at the eye in the lanes. It was another world. It was just the most fascinating thing I'd ever seen. And I also have, in the family, there's some eye doctors as well in my family. My grandfather, my dad. So it's in the genes, but more importantly, it's something that continues to remain an incredible challenge to try to keep people's vision. And it's something that keeps me coming to work every day for sure, 31 years. But I think it's just, when you fall in love with something like that, you're just lucky. I'm just lucky to have been able to discover that and practice it in a way that I think is meaningful. And I'm very lucky to have had incredible teachers. I got to train at a great place in Philadelphia called Wills Eye Hospital to learn glaucoma. And Dr. Lynn, who was my chairman at the medical school in ophthalmology, was also my partner for many years. And he taught me so much that it allowed me to do the best job I could.
When was your first aha moment, thinking back then? Was there a moment when you said, I have helped this person preserve their sight? Any particular story that you have?
Well, there are certain moments that you don't forget, but I remember in my first year of practice with Dr. Lynn, so this would be 1983, we were sent a baby with glaucoma. Actually, by then he was, I think, maybe 6 months old. And he'd also had cancer. He had what's called a Wilms tumor, which is a kidney cancer, and that is associated with glaucoma. So we were sent this patient, and we did the conventional surgeries that were supposed to help take care of the problem, but they didn't work. And we were trying to brainstorm about what do we do? How can we prevent this person from the next 100 years of being blind? And about that time in New Zealand, a doctor had invented a tube for glaucoma, a drainage implant. And it was called a Maltino at that time. And there were really none being done in the United States, maybe a few in some part of the country, but we thought it might be the thing to do. I called one of my colleagues and we talked about it, and we thought it was the best thing. But here we are, never having done the procedure before, not really anyone to talk to about it, and one article in the literature. But it was the faith I had in Dr. Lynn, because I showed him the article, and he was my mentor and someone I looked up to big time. And he looked at it and he said, I think this may help save his sight. This may work to lower his pressure. Well, I was a little nervous about it, and certainly Dr. Lynn had a lot more skill than I had at the time, and I said, well, good, you can do the first one. And he did, and I assisted him. And that's the way it should have been, and it was. And we still see that child today, 31 years later, and they're doing okay. And you know, that was a moment that was, wow, this is the real deal. This is big time stuff. This is stepping out over the cliff. But you know, in glaucoma, sometimes you just have to do that in order to take care of things that you have to do, because sometimes some of the older procedures don't work and you have to step out on a limb. And that's what we've kind of done in this practice, try to advance glaucoma care.